The U.S. House and Senate have already passed legislation that would help first responders who've been at the forefront of the pandemic. It's named after a doctor who died by suicide during COVID-19. President Biden is expected to sign it. News 6's Treasure Roberts takes a closer look at the legislation and how it could help those who have helped so many.
Working up to 18-hour shifts without breaks, Dr. Lorna Breen always put her patients first. She's been a short time away from New York Presbyterian Hospital in Manhattan after contracting COVID-19 in 2020, but returned to horrifying sights of sickness and death.
What she described to us was Armageddon. Too many patients dying in the waiting rooms, not enough oxygen or supplies to take care of them, not enough beds to transfer them to.
Weeks after her return to work in April, Dr. Breen died by suicide. Corey Feist is her brother-in-law and also the president of the Dr. Lorna Breen Heroes Foundation. He created it with his wife Jennifer, Dr. Breen's sister, following her tragic death.
My wife Jennifer and I heard from healthcare workers across the country and across the globe about how hard it is to be a healthcare worker and how the concerns about their own well-being are never top of mind.
Previously, I shared the struggles healthcare workers in Central Florida have been facing since the pandemic ravaged the globe.
All of the nurses are really tired. There's no motivation anymore.
Adriana Quazzo, a nurse at Osceola Regional Medical Center, broke down, feeling guilty for not performing at her best.
I am really sorry that I cannot give more. I wish I can give more. But trust me, we're doing our very best.
Feist and members of the foundation pushed for legislation to help medical professionals like Quazzo. The Dr. Lorna Breen Healthcare Provider Protection Act could soon be passed into law. The bill will require the Department of Health and Human Services to award grants for mental and behavioral health training for healthcare students, residents, and professionals. Other provisions in the bill require a campaign be formed to help prevent suicide and encourage healthcare providers to seek mental health treatment.
We welcome this attention to the mental health of the healthcare professionals.
The foundation reports physicians and nurses die by suicide at 2 times the rate of the general population, and burnout has been shown to cause a 200% increased risk in medical errors.
You cannot do your best work taking care of patients unless you engage in self-care.
Feist tells me President Joe Biden funded the programs listed in the bill in the American Rescue Plan last year, adding the programs are already making an incredible impact. In Orlando, Treasure Roberts getting results, News 6.